Okay. Good morning, everyone. This is Christopher D. Greif. Hope everyone is doing well. Hope everyone's enjoying this beautiful weather and feeling the love, the holidays, and the good spirits, and keeping smiling because I see some smiling faces today. And attendance very well high. And that's not the correct number. So let's make that clear. First of all, I want to welcome everyone to the Family and Provider Information Committee. As a reminder, everyone, before we introduce our two young ladies, the famous ladies, and I know one of them is going to kill me later, but that's okay. As I move on to and I apologize, my system just went a little boo boo, but that's okay because it's called switching my hands around. That's why we have two devices. But I'd like to remind everyone here that please, as a remind you, housekeeping rules are very important. So I want to make sure everyone knows that please always make sure you come in. Please put your name on the chat. There we go. As a reminder, everyone, I know this is annoying, but we still have to follow rules and regulations because we do have some new people at this meeting. So I want to make sure we follow the guideline rules. It is very important that we mute our microphones. There should not be 3 or 4 microphones on because if you do, the microphones automatically will go into mute mode. Second, your video cameras, as you already, some of you are on, thank you, are there for, you can use them on or off, your choice. As a reminder you also, hand raise, if you're on your computer, you can use the hand raise. Please make sure you have a question, please raise your hand. If you're on a cell phone or a tablet device, please use the chat and say, I have a question. Don't have to use my name. You don't have to use Deborah's name or Rose. Please use the main question I just said. I have a question. And we'll make sure we get to you. But please, guys, let's try to make sure we have no interruptions and let's keep the piece running. Also, if you just want to put your questions in on the chat, it is very important as well. It will help you to do that as well, to put those questions in. So please make sure. Also, as a remind you, as the caption is going on as I'm speaking to you right now, you can use that available right now. The caption levels are there for a reason, so in case you want to read or what I'm saying on these words are available. So therefore, you can look at it, enjoy it, and if you want to use the other new device that keeps the scripts that what we're saying, it's also available in the chat system. Just scroll over to transit script, make sure it's turned on so you can save every information that we're saying. And please note, some of the words may not come out clearly. So please make sure what you're saying is clear the best you can. We'll just do the best we can. This is something new that we're trying to do for the joint meeting for both councils to keep the minutes running. But I remind you, you will always see this question. Any questions, raise your hand or type it on the chat. So I'm pleased reminding everyone, please let's do our part to keep the meeting running on time and professionally on that. So it is now my greatest honor to introduce our co-chairs. First one starting on the on my right is Rose Sal, provider, co-chair, Rose Sal.
Good morning, everyone. Welcome and welcome to the Family and Provider Information Committee. I'm so glad you guys are able to make it today. We have a packed agenda for you all. Happy Black History Month, Happy Chinese New Year, Valentine's Day up next. It's good to have you all. And we have a lot to talk about today, and we're going to go through our agenda, to discuss everything that we have ready for you all. And also, I'll be giving you some highlights on what's coming for March and April as well. Before we start, I want to introduce my co-star, Deborah Greif.
Good morning. I didn't know. Thank you for promoting me to co-star. Thank you, Rose. Okay, but thank you so much. First, I want to say Happy Black History Month. I'm very glad. I wish it really was on. I wish we could do this with months that are bigger because it's so important to know the history. And also, I want to wish everyone who celebrates the Lunar New Year or the Chinese New Year, but I'm going to say Onge Fa Choi, it's belated. Next, I also want to wish everyone coming up is Happy Valentine's Day. I hope everyone gets something special from anybody they love, whether it's a husband, boyfriend, girlfriend, more important, your children or your parents or whoever, friends. With that, yes, Rose, our coach here, she's got some great things to bring up. But with that, we do have a very packed agenda. And I also just want everybody to know, yes, the advisory council and the joint committee will be next week, only because we're celebrating this month 2 presidents' birthdays. We're going to be celebrating the late President Lincoln and the late President George Washington, is known as President's Day. And we're glad we can celebrate that. So with that, Rose, do you want to bring up you want to start with what we're going to be doing on the agenda? Christopher, can you switch to an agenda?
That's the thing. You guys didn't give me agenda. So this would be a good time
You'll have
if
to
you
do it
two give me
verbally.
your reports.
Okay.
And then we can talk about the roles of the
So-
OPWDD a little bit.
All right. You know what? Let me just do a quick, very quick, fast. I just want everyone to know, yes, on this committee, I'm the parent co-chair. But yes, you know that there are 19 advisory councils across the state. And yes, we are working very hard to maintain and update and see that the family support services that were put into place in the late 80s, 90s after as a pilot project, our council is working very hard to maintain and to keep our family support services funded as best as, and to see that they're running. The biggest problem we're having right now is lack of staff, and that's also because of COVID-19 and all the variants that came. And yes, we thankfully certain things could be done virtually, some things couldn't. But the statewide advisory council under the new chair, Chris Halega, if I say his name wrong, I'm sorry, so I'm going to call him Chris P for now. He has got a very robust agenda for us to work. I'm on the committee that does the working on the front door, what is given to families when they come in. They're going to approach to come into OPWDD. The other committee they're working on is also consumer satisfaction surveys. Those are very important, and I hope every professional on this call and parents understand. Everybody should be filling out those surveys because those determine what services are working and what they're not. And negative, if you're saying it's negative, it's not a terrible thing. Don't get angry at the families. That gives you a first-hand chance to figure out how to fix it. Maybe there's a lack of communication. Maybe the family doesn't understand. But when if the program is really fantastic, write it. But at the same time, if there's an issue or things didn't go the way you thought they should, put it in writing in those surveys. So they're being worked on. I apologize, going to be updating that. I don't know when the next subcommittees, because I said I'm on one. Of course, we're all working on the rechanging certain things for reimbursement. I have no further updates, and I won't go into it because we do have a robust agenda. And with that, now I'm going to now turn this over to Rose, my co-chair and co-star.
Thank you, Deb. I just wanted to add before we go to our topic of role of OPWDD. I just wanted to add it that again in this provider information committee, we want to have provider right also on this call, as many providers as we can. This is where you're going to get the information that you need to do your jobs, to provide to families and to care managers that you encounter. So it's really great to have representation. I know we talk about that every meeting, and I'm going to keep highlighting that because I don't see all the providers that I know that is under OPWDD on this call. So it'll be great to have. This is not Rose and Debbie's, information committee. This is our committee. So we all need to be involved. And also, if you think of any particular subject or topics that you would like for us to discuss or address on this committee, please feel free to send them around my way, Debbie's way, and Chris' way, so we can, put them on the agenda and also get speakers. Or if you know of any good speakers, any topic that you think that'll be great for families or for providers, let us know and send them around our way so we can be able to continue to have like a fruitful conversation, right? Like for example, coming up soon, we haven't have a speaker yet, but I am working on a speaker for our next month meeting on ABA therapy. And one of the care manager from Care Design, actually for the supervisor, Mary Ellis, who's on the call, had brought it up to my attention that family members are asking, about ABA therapy. So we're getting someone to come and talk about that topic. And the month of April 13th, we're also going to have a meeting on guardianship. I think it's been a while since we talked about guardianship. We're also going to bring Paola Boone to come and talk about guardianship. So if there's any topics again that you would like us to have highlighted, discuss, raise awareness on, this is the great time to bring those topics forward, and so we can continue to have a fruitful conversation. We're not meeting every second Wednesday of the month just to meet. We want to make sure we bring in education for family as well as knowledge for providers.
Rose, there's a question for Deborah and you. Can you guys answer this question?
Okay, what's the question?
Okay, can you explain what is your meetings are always the second Wednesday?
Correct.
The parents asking this question. Let me let this person. I'm reading the question. They're asking is, and I know Janet David's going to have her hand up in just a second. Janet, I see it. The question is the parents are not really getting the information. Who can they complain to?
Janet, do you want to? Okay. Well, can they clarify? The parents clarify the reason why I say that, because it'll make it easier for us to understand.
What
because there is a way to complain and not. So, okay, I'm muting. So Janet can talk.
Yeah. Hi, everyone. Good morning. I think it's, as Deborah said, it's really important to know specifically what the complaint is. I know in Manhattan, a lot of the parents who are confused or have, some disappointments or complain come through me sometimes, and then we decide from me where it goes. And it also depends on the topic. Some parents are complaining about residential placement. They're complaining about family support. They have issues about their children with behavioral issues. It runs the gamut. So there's nothing wrong with starting with your family support coordinator in the borough, and they can, instead of giving you 20 different names, and they can, send you on your way to the right person. I think that's probably the best. What do you think, Deborah?
I feel that that's good, but sometimes I find that, I'm just saying it this way. I agree with you, Janet, but sometimes families have been made to feel guilty when they have a complaint. And I tell families, don't feel guilty. You can complain, but let's hear what the subject is. Like in reference with residential placement, there's always going to be, unfortunately, a very long list. I don't have a say over it. Neither does Janet, Rose, not because we don't want to, but there are guidelines of how you get placed. It's not the greatest, but I have to say that I understand how the placement is done, and maybe that also should be another topic, because I've noticed years ago that not everybody understands. Years ago, the previous chair of the Queens Family Support Advisory Council was Carol Ianta, who had a fantastic list. And I remember when we did the citywide advisory council, she sat all of us down, especially the younger ones like me, and explained what does it mean when your child is to be placed. Not just, why and what type of placement is the correct one for your child. So maybe we need to do that in the future, and that we need to discuss to do it with OPWDD as well as the agencies, because it needs to be, it's the end all, but I find that when we work together as a team, it does wonderful. I just want to bring up one other point. You can also complain to us, say, about Social Security, SSI, SSDI, or Medicaid, or Medicare, or certain other thing. Please understand one very important thing. OPWDD does not control Social Security where SSI and SSDI falls. Medicaid is not also controlled by OPWDD. You have to have, of course, the appropriate label, and I say labels, classification of disabilities to qualify for certain things. And this is not only just set up by New York City, New York State, but it's also the federal government. But yes, we can assist you on who and how to figure out where to complain, because I was sent to by late Kermit Augustine and the late Era and Cal Fischetti, who made sure that I learned how to do the correct complaining. Because they said to me, you have to learn to complain, and then you have to figure out a good solution. So we should also do a couple of workshops on the appropriate where to complain, how to complain, because that will help both the families and the professionals. Now that I turned it over, is this that the parent have anything else in the question, Chris?
Hold on. You got another question that just came up. But before I do that, Henry, excuse me. Can we one person at a time first, because the only two I can handle right now is Rose and Debbie, because their microphones are linked to the co-hosts. But right now I gotta read also, because one thing I have to bring up. Henry, this is, if you can hear me or whatever, please check your. Okay, first of all, guys, the microphones are working. It's not me. It might be your Wi-Fi end, but I am going to remind everyone to please check your Wi-Fi, because the Wi-Fi signals are maybe getting interrupted, because, as I said, they are doing construction, not in my end, but in your end of where the 5G is being updated. Please make sure you check that as well. So
Chris, Ann Davis has her hand up again, please.
I know. I'm reading one person because this is just brought up. There are two people having connection, not hearing you clearly. Can you both, Rose and Debbie, please raise your voice by 5% more? Thank you. Janet? Yeah, Janet?
You know, going back to what the original was, where can people complain or show concerns? There are so many different types of concerns that we can't give out 20 names. It's not going to work. So I think even a lot of families, Deborah, probably go to you also. I know in Manhattan, they go to our Family Support Council, Advisory Council, and then they will funnel it to me. And I hopefully that we get it to the person that needs to hear it. So parents shouldn't sit with any kind of a concern. They should let it be known, but they're not always going to get to the right person at once. So possibly the Advisory Council, possibly the Family Support Coordinator, just to start the process.
Yeah, Janet, I totally agree with you. I was going to say the same thing too, because there's so many, complaints and concerns, right? And also every agency, for any family that needs to know, every provider agency have a grievance process, right? There's someone that you can contact there, whether it's starting with your care manager, to whoever is in the provider, whether it's your day hub, whether it's your com hub, so there's a grievance policy for every agency on who's the point of contact when you do have a complaint to report to. So I think for the family who asks the question about the complaints or concern, I mean, sometimes there's complaints about more like resources, right? So I think it's like Deborah said earlier, it's good to be clear so we can know exactly is it an issue? Is it really a complaint, or is it just a concern, right? So it's good to highlight those and give clarification if you need support and how we can support you. And if it's something that we need to bring into this, provider meeting, right? And that's a great way to start, but encourage families to come to this meeting as well, right? Because when we have those information meeting for families, a lot of time we don't have a lot of family on the call. So if it's something that you can pinpoint what the concern is, please let us know, and we can bring someone to, bring it, have a further, in-depth conversation about it.
Okay, I'm fine with that. I agree. I want everyone to know I agree with both what Janet Davis said and my co-chair, Rose Saul. I completely agree with that, because we need to help everybody. And sometimes you're right. We have to hear what the complaint is so we can figure out who do we send this person to. But yes, you have the right. If it's in the agency, you're getting services. Yes, they have a grievance process, or I'll say it's simpler for certain families because I know there are a few groups that are having with translators out there. Complaints, a grievance and a complaint are similar. It's a synonym. And just want everyone to know, everybody has the right to make some form of complaint, and because sometimes complaints end up opening up to find out what is working and what's not. So that I'm fine with. Is the question, did we answer the questions or not, Chris? Because I don't know.
You did in one way, and actually adding a bonus to Janet Davis and Rose, it does show a three-way showing that we all need to remember one thing, and this is what I'm going to add in, is as an individual, that it's a team effort. But the one thing that I'm seeing that some people are forgetting, and I'm not saying who it is because I'm just act professional, there's, during, with not just budget and stuff, but, if we're going to be helping a fellow parent, a fellow individual, or a fellow agency, we need to work together and stop saying, it's got to stop one way or the other, saying, I'm better than you. I'm better than. It has nothing to do with that. We might not like each other, but we have to work together to help the families that are out there. Language or no language, disability or no disability. And just remember, not all disabilities stay at a certain age. They do turn to seniors. So we got to make sure that information is going out. And the second thing is it's got to stop is, as an advocate, I will say this. I don't like making promises because know why? Because then I will get shot by a parent or a fellow individual. So we got to make sure that we do the best we can, but work as together. And the person who mentioned it, she's saying thank you for all three of you, Rose, Janet Davis, and Deborah. They're saying thank you so much, because the reason why I attend this meeting from Brooklyn, because this is what I need to be, is seeing people talking, agreeing or disagreeing. I attended the joint meeting for a reason, because other borough meetings are boring. They're not really talking about information. And they're saying this for a reason, because they know that two people they know from here, from OPW, are here, and they want to say thank you. But very important thing, they're really happy is they're seeing a parent and a provider both working together. So this is what she's saying, and she doesn't want to say her name because she doesn't want to get shot. I'm telling you, I'm reading what she says in a private chat. Please understand.
Not a problem.
Thank you.
Thank you.
Do you guys want me to move on to the OPWDD screen next and then go to the
Yes,
website?
please.
But
Yes.
before we do that, does anyone else have a question? Guys, when you're not speaking, can one of you guys mute, so therefore I don't have an echo, because there's an echo coming in. Thank you. Nothing against you guys. It's just that when an echo comes in, it's very hard to hear or see. And I have my camera off for a reason. So since no one else have any questions, ladies, I'm turning on to the next page. Who's going first?
Okay. You want me to start, or you want to start, Rose?
Rose, you're muted.
Rose, you or me start? Okay.
Rose, you're breaking up. Repeat that last
All
word.
right. I can't hear you, Rose. All right, you know what? I'll start until Rose gets it straight. Okay. I want everybody to understand things. You see, that is New York State's capital in Albany. We don't have an updated picture, a picture of where OPWDD is. That's at 44 Holland Avenue in Albany. If you're looking at the Capitol, it's like this, going a little northeast of it. But that is where the governor and our state assembly and state senates meet. And we just want everyone to know New York State, the role of OPWDD is the overseer umbrella. And if I say it wrong, I don't mind if you, Janet Davis, and you, Henry, open up and stop me before I say anything wrong. Or if you think I say anything wrong, correct me. I'm fine. But what I
Duly noted.
of OPWDD is that this is the office that when families have children most of them were diagnosed before the age of 22, which have a developmental disability, there's an umbrella of different developmental disability that go under OPWDD. And also OPWDD has an umbrella of agencies that they oversee too, it's not just family support services, that's one of them. There's adult services. Now it was changed from Medicaid service coordinators to care coordinators. But that was a change that they felt they had. Their updating. OPWDD from when I first came in used to be known as OMRDD, and now we've updated to OPWDD, whereas it's the Office of Persons with Developmental Disability, because we may have the individuals may have disabilities, but the important thing is they're still persons, people. They're human beings who just part of them is having a disability and they need the help. Now, the very important issue is I want everyone to understand OPWDD does work as a partner with the New York State Department of Health, the New York State, the Office and a lot of the of Mental Health, because we do have individuals with dual diagnosis. They can have triple diagnosis. But we're going to just stick with OPWDD. Now, as I said, it's constantly involved, but the biggest problem, besides the COVID-19, is I have families don't understand how to use OPWDD's website. And it's very important because you see, there are times the parent doesn't know where to look. It can be very overwhelming because honestly, when you first get that diagnosis, even if you know in your heart it was there, it is still overwhelming because it's not just you having to deal with the child's developmental disability. You have to deal with your family and society and try to get the right appropriate education, hopefully, for your child. Because there's another thing that's very important that it was drummed into my head by the previous advocates that came before me that helped with the issue about Willowbrook, but they helped found the when it was OMRDD. OMRDD is not a mandated. Only thing they told me is mandated in New York State is education. From age 5 to 21, children who live in New York State are to have the right to be educated in the appropriate setting for them, and they have until officially to age 21. If it's proven that they need additional services from the New York State Department of Education, they deal with that. OPWD can suggest, but they do not control the state office of, our state education offices. Their job is to deal with developmental disabilities. Now, the biggest problem we've also had and why we've switched to being virtual is because, unfortunately, we had this COVID-19 novel coronavirus. Yes, OPWDD has a big page and a lot of good information on their website. And that is a wonderful thing. I'm not saying the virus isn't wonderful. I'm saying what's important is that we do know their rules and their guidelines. And yes, we know that they want our individuals as well as staff. Many of our individuals sometimes do have issues about being masked because of their developmental disabilities. But they do want the staffs to be masked, gloved, and protect themselves, wear face shields. And I agree with that. Since most of our children have some form of a compromised immune system, I'm very glad OPWDD put this out. I am also glad they've done everything possible to help our families whose children need to be vaccinated or at the right age to get vaccinated. So OPWDD has a page that is about the COVID-19 vaccines and also their requirements. If I said anything right, Rose, do you want to add anything?
No, can you guys hear me better?
Yes, now we
Okay.
hear you.
All right, great, awesome.
Rose, I can hear you loud and clear.
All right, awesome.
Yeah.
So, Debbie, I just wanted to add pretty much everything you said. I think for parents to understand, I mean, even provider agencies, sometimes, you go onto the website and it's very challenging to, find, what you're looking for, right?
Right.
I think OPWDD is aware and are working on really making this site a little bit more user-friendly in some area for, in some of the tabs. But in terms of the virus, I wanted to add that OPWDD have really stepped it up and sending every single providers, testing kit for the programs. I actually myself had to contact the Queen's office to say thank you because, our clients, even though we all doing social distancing, we are wearing our masks, but we do have some of our clients that are, testing positive, and having those testing kits on sites to provide to our individual to go home and get tested, or anybody that was in their vicinity, is very helpful. And I think tests were sent out to every single site, residential, day programs, everybody have 1 or 2 boxes of kits. So I just want to say thank you about that. In case family doesn't know, those tests are available for your loved one that are attending programs. Also, when we're looking at the OPWDD sites, in terms of providers, this is where we go and get information. In fact, there's resources as well there for family members. I know we talked about residential. There's a section on the site for residential as well, where you can go and get that information to see what's available. But again, you're not alone, right, in this process. This is why you have care managers, is to help you, to assist you, because we know the system can be cumbersome, right? And this is why you have support in place, for your loved ones, so you can get the support that you need in order to navigate the OPW system. We had OPWD represented. They come, they talk to us, letting us know where to get the resources, how to get the resources. So it's really connecting with your care manager. If you want to get educated, the tools are there. You just ask, and how do you get the support, right? So one of the challenge that I want to address, and I know that was really big at the beginning of the pandemic, it's technology, right? A lot of our family members do not have access to to technology, and it's ongoing for almost every provider. It's ongoing issues that we are facing and challenges that we are facing. And also, if they do have technology and they may not know how to use it, I know at Brooklyn Community Services, my agency, we do a lot of training for parents and our members and the clients that we support, just to kind of educate them on how to use Zoom, how to do Google Meet, how to use Google Voice, just so we can connect with them. So I think that's also a big piece that, we can, going forward in the future, we can start discussing more and see how we can get more technology for the individuals that we support. I don't want to keep going on. Oh, go ahead, Deb.
Okay, I also am very, as a parent from the parent side, I am pleased because I appreciate that OPWDD stepped up to the plate and went way faster than a lot of the other O agencies. Only reason I know is that I am on my local community board, and where they have what's called a borough meeting, and also a meeting with all the providers in our district. Like, I live in community board 15. So the chairperson shared with me that not all the other agencies are following the same protocols and help the way OPWDD has been. And she was very pleased because, this variant, these virus, it spreads quickly. That's how the common cold is, the virus. So we appreciate and thank OPWDD for going above and beyond. So with that, let's go on to the main page, please, of the website for OPWDD. And yes, it's easy to link through if you need any other information. Chris, can you go to the next page, please?
Which page do you want? You want me to go to the front door? Access support?
Yes, first go where if the parent goes on, what's the first place they should be looking?
Access,
and the providers to help
support.
Well, go there, please, because I'm not controlling that. Sorry. Here we go. Okay. Well, as you see, OPWDD's website, truthfully, has gotten even easier to use. Many hosts, and I say this with no shame at all, when it comes to the computer as well as the website, many times I'm the one with the developmental disability and my son's not. But that's fine. But it's gotten easier and easier because now we see the first wet place that a parent has to start, as well as Rose and I know, Jan and Henry know, we have to go through the front door. Because that's where, and when it first came out, a lot of people were complaining, and I wasn't. And I'm going to tell you why. I didn't complain, and many members of the statewide didn't complain. A lot of families don't understand what a developmental disability is. They don't understand how it's determined, why it's determined. Many of them tell me when they're in school, I don't need OPD, I have the Department of Ed. Yeah, to age 21, you may have the Department of Ed. But from birth to death, as well as, it's true as I said before, I was trained very well by a PWD. From birth to 7, every child, even if you could tell the kid, may have a version of some Down syndrome or other syndrome or developmental disability, you could see they're still provisional because children make the most growth. They update, they grow, they change the most in the first 7 years. But not a lot of families understand that what you get in school is not what you get in life. And OPWDD is for life, how you live in your community. If I say anything wrong, ladies and gentlemen, click in. So now, why am I happy about the front door? Because now I really understand, and it's easier for me to explain to all the families why you need OPWDD service. Do you want to add anything, Rose?
No, I think one of the beauty of the front door is that, when parents go in, they getting all the information that they need, right? They could have called, for example, BCS, right? They're learning that it's not just BCS that is out there as a provider agency. They get the master list of every agency that provide OPWDD services. It is definitely person-centered, right? So they know what is going on. They have the choice to choose what providers that they want to go to and get all the information at the front door of all the programs that are available, to them. So I think, it's a great tool. It's a great way to start. They get to learn about OPWDD right at the front door and all the services that, that comes with and that they can help, to navigate for their loved one.
Yes, and the other nice thing they have been doing, which is very, I'll call you 1 second, Janet, I promise, is that they explain to the families that, because the first thing I am told all the time, I need Medicaid right now. And I say, for what? Well, I have a child with developmental abilities. And I'm going to tell you truthfully, I tell them, there are, with family support services, you need to have the child, of course, diagnosed with the developmental disability, and the front door explains. And I like that because I want families to understand that you need to start setting up, because I tell them when I advocate with them, your children start as a blank slate and you have to build that, it's like a house, you build that strong foundation. So the front door does explanations on this, and it's important for the families to know that it's not just one agency that can do it. Janet.
I have to unmute. Deborah, that's all very true. And Rose also, I think one of the biggest issues is that parents are very overwhelmed. They're overwhelmed sometimes with their child's diagnosis, and then they're overwhelmed with all the information that's coming to them at once. This is a completely new system. And what I keep telling parents is take it in, take notes, bring a book with you, take notes. You're going to hear it over and over again. And at some point it will sink in, but parents get very nervous when they hear about all the programs and how do I do it and what's waiver and how do I get Medicaid, and It's a process. Sometimes it's a slower process. Sometimes it moves a little more quickly. But in the end, the family members are going to get lots of services. But parents should not be concerned if it's overwhelming and they're not, oh my God, what am I going to do? I don't know how to do this. You get a question, and you're at the front door process, ask the people at the front door. Eventually, you get a person from the front door to work with you one-on-one. You ask them. But again, it is overwhelming to families. I want them to know that they're not the only ones feeling overwhelmed.
You're
Yeah.
absolutely 100% right, Janet, because we, the families, it is true, we are very overwhelmed. And honestly, I could have probably used the front door when I knew of my son's die. I accepted it. But at the same time, it was rough for me because I've had people tell me all the time the amount of horrible things said to me. Some of it was from my own family about with my child. But I did the right thing because I knew that even though I was trying to get everything sunk in, and it's at that time there are other rules that interfered with me getting everything I would have liked for him. But by constantly learning and waiting until it absorbed in my brain was a big help. I see the hand up at the Brooklyn Families Place. Chris, you have the hand up. Everything okay?
Yes, there's a question on the chat. The group wanted me to answer this question.
Sure.
And one thing, they're glad that Janet Davis said something too. So Janet, you're batting 2 for 2 right now with Rosal. So this is one thing they're asking this question. When they do the front door, and they do call, and they understand that yes, but they might miss the call. So Janet, this is coming also for your in all the boroughs. The one issue they have is one, they call when they do call, they understand they have to wait maybe 3 to 4 business days, but a week or two, it's not fair. And second, how come they don't explain? And I'm sorry, but I'm reading what they're saying, so please please don't attack me when I say this. Why they don't tell about these councils with an S? And they said when they go to a front door, and let's just say it's one of the boroughs they're mentioning, which I'm not going to say because I don't think it's not going to be for all the counties. They don't give us the guidance where we should go after. When they went to one front, can I finish?
Go ahead. Sorry.
When I went to one front door and they said I can say it, I went to the one in Manhattan. Another one said I went to Brooklyn. How come they mention our councils? But if I go to the one in Queens or the Bronx, I don't get that information. Bronx, I'm a little surprised because Bronx always gives that information out. So this is what they're saying. If Janet or Henry want to answer that question, or Rose or Debbie, you don't have to raise your hand, Janet. Go ahead, Janet.
Okay. Yeah, I mean, always there's disconnect in every system. There's a parent who calls and wants an immediate response, and that's not always possible. Sometimes if it's an emergency, it should be possible. If it's a front door issue, try to find out who the supervisor or the team leader is of the front door. I could certainly send an email to some of the people in the front door and ask that when they give out their packets and their information, that they include the councils, all the different councils, family support, the advisory, the committee that we're on now, the DD Council, so that they have an idea of where to go from that. And of course, parents don't know what questions to ask at that point. It's still that new system. So I'll certainly reach out to the other boroughs and just see if they can kind of insert something with information that they give out about the different councils, if that'll help.
Yeah, that will help. One thing, as being on the front door committee for the statewide, I want to say this. We have a teeny little issue, and I'll explain what it is. New York City is the only part that has a 5-borough DD, Developmental Disability Council, because actually I'm not going to go in but the New York State Department of Health and New York City Department of Health and Mental Hygiene started these committees before the Family Support Council came. And yeah, I saw the timelines, but the part where we have to fix on is that if you are living in these counties, which would go New York City, you can go to the Brooklyn Families Puts. You can go any of the advisory councils, and we have the information we're putting on. They should be contacting us, and we give the phone number, emails as well, and also we are on Facebook and Twitter best we can. But for out of and also New York City's on a different budget time. We're from April 1st. We're from July 1st to June 30th, but the rest of the state is April 1st to March 31st. We are working on to make sure that there's full communications, because for families who live in Queens, who are at the border where it's Nassau, we let them know that's a different. They go on. You live. We try to give them the explanation of where to go and get the information. I will say honestly, I understand your frustrations when they don't call you back or contact you, but also I'm going to say something because I feel it's safer if I say as a parent. Please make sure that you say your name clearly and you repeat your phone number at least twice. If you have trouble and you don't think they understood you, maybe because English is not your first language, ask a friend or family member whose English is more understood to call on the phone with you nearby. It is very important for you to have good communication, but you see, they can't call you back if you don't give them the right phone numbers. We have this on I'm going to just talk only for my council. I have a phone number, 718-642-8512. It is manned by our executive assistant, Mrs. Ann Menino. Many times she's had to text or call me, I need you to check, because she couldn't catch the phone number. So what I'm asking everybody is, please, if you're with the parent groups, explain to them they have to leave slow, clear messages. Even if you just say, I was at front door, this is my phone number. Give the date you were at you can say, all right, I was at front door February 1st, 2022, virtually, or on Zoom, wherever. My phone number, if you have, say your phone number, but not like Rush Go, 718, like that. Say 718-642-8512. So that the person listening can catch on and then write it down and get back to you. It's very important. It's a two-way street. So you have to make sure, if you don't hear from them, call back. And if there's a problem, contact one of the advisory councils. We will try to help you, link you with the person you should be talking to. But it's a both way, because I can't blame OPWDD or yell or scream at them if you didn't leave a clear message with a phone number and if they leave you a message and you don't get back to them, it's a two-way street. So we have to practice good communication skills. Yes, we're all overwhelmed, but please.
Excuse me, co-chairs. We got to move on, but also at the same time, there is a question that just been brought in. Rosia just put in. I want, if she can give me a second, let me read it first before she types. Wow, faster than stealing bullet. I wonder to why most of the time parents don't read these booklets giving out to help navigating and guide them. Could there be in a lot of process and understanding? It's on the chat. Unless Rosia wants to add a couple of comments. Rosia? Rosia, can you unmute yourself?
Hi, good morning, everyone. My concern is when parents get these booklets, sometimes they don't read them, and most of the information's there. So I was wondering if it's a lot for them to just even consider and sit down and read through them. And then we don't have that many videos. Maybe it could be a parent that is a visual, and watching a video will be more helpful. So I don't know if we can advocate for something like that.
Yeah. That's
Um,
not, yeah, I mean, that's not a bad idea. I think you're right, was, yeah, there is a lot of information for parents, to navigate. I guess that's something we can look into for the future for OPWD to move on if they want to, add video. I know there is a lot of YouTube videos on different things, on OPWDD if you're looking for a certain particular thing, but not necessarily like, at the front door, but maybe a small video of the front door process for family members can be helpful.
Okay, I will bring this back to the statewide and to the committee I'm on. I will talk with my fellow parent members, as well as the people we are on. This is an excellent idea. We have brought it up before, but this pandemic makes it probably more important that we have to also do certain things virtual, on Zoom and stuff. But we also have to get certain things also said in other languages like Spanish, Russian, the Chinese dialects. That's an example. French Creole. So I will bring that back. It's an excellent idea. Okay. Anybody? Janet, you want to say anything? Henry?
I wanted to raise my hand, but I just don't know how to do it from this end. So I just wanted to add. I put it in the chat.
Permission granted, because you did ask it on the chat.
Thank
May
you.
I have an additional question?
Thank you. So I just was wondering, when we consider those videos, it would be helpful if they can be linked to each other, because sometimes I know parents are not really understanding what to look for, and that could be another reason why, even though the videos on YouTube are there, they when you're new and you're just understanding about your family member, how do you go and look for certain videos that are supposed to help you, but you don't know that yet? So you don't know what titles to look for, what names to look for, and it could be helpful if they can have an attachment. So it could be like, follow this video and they go on to the next one as a suggestion, and it will be helpful for the parent to really understand throughout each and every video. Thank you, everyone.
Thank you.
Excuse me, guys. I have to interject for 1 second. I'm sorry. Rosie, your question is good. Because we just had someone came in. Can you please identify yourself, SM6960U? Can you please unmute, identify yourself, please? The person who just came in now, can you please identify yourself, SMG960U? Please identify yourself. Please unmute yourself. Okay, at this moment, Madam Chair, that person is not responding or unmuting.
All right, well, let's move
on.
on.
Go on. We gotta go on.
I'm gonna keep an eye on it, but if anything comes up, I'm gonna have to remove them, because if they don't identify themselves, they could be a hacker. I have to be really careful. For the record.
Understood. Okay. All right, let's move on. We do have the booklets on the front door. There's Henry. And okay, what's very important is we do have the front door, and everything that was asked, we do have the brochures on there. So, and I believe they are put in other languages. Only reason I'm having trouble seeing because it's small for me.
There
are other languages. Thank you, Rose. I appreciate that. Okay. So please guide the families to do the front door brochures. Also, let's go to the family support page.
Give me a second.
Not a problem. We're patient.
Maybe you should explain once they're done with the front door session.
Oh, yeah, that's my fault. Okay. What's also important with
Rose,
the front door session
as well. You and Rose.
Is very important is that you when you attend one, please inform the families. It's very important that they are there. The child is not nothing against children, but you want to be. We need to concentrate because we're already overwhelmed. Our child has a diagnosis or a developmental disability, and you want to make sure that your child is getting services through service providers, but of course want to be under the OPWD umbrellas, so to make sure you get the right help or services. So it's extremely important to inform them to please. Now, also, they will be getting a certificate that will be emailed back to them. That's why it's very important to leave an email address or a other address. I'm going to ask this of Henry and Janet. Do they, because even though it's done on virtual, say like they get a group of 3-4 parents, because they don't have their own, they don't have a computer or printer stuff at home. Do you mail, the old such thing, the snail mail, a copy of the certificate that they attended that day to their home address? I'm just asking because I don't know. Can someone answer, please?
Yeah, I'm not sure. I don't know. Marilys, do you know on the care manager level, does the family get the certificate via email if they don't have a computer?
Yes, they do receive it in their email when they complete the session. Because to join the session, you're calling in or completing it, and that's your proof. So you do receive it. And we are able to retrieve it. As a care manager, if the families don't have an email, we're able to contact the facilitator and find out when they completed it.
Oh,
Thank you very much.
You.
I appreciate that because I haven't done a front door for a few years, and I haven't done it virtually. I'm being true. Thank you. All right, as you see, next also we do, and yes, we are working very, very hard on this, the statewide family support councils, because you see, there is a statewide developmental disability council and the family support service councils, but we're a subcommittee of the statewide. And yes, we do have a few members. I know that Kathy Nowak from Staten Island, as well as Margaret Puddington, are still members of the statewide developmental disability council. Right now, Margaret Puddington was the chair of the statewide, but now she is representing Manhattan for now until they find someone else. Kathy is the Staten Island representative. I'm Brooklyn. And our role is to and we do meet with the commissioners, because I've met with every commissioner since Commissioner Thomas Moore, to let them know how family support services are working in our area. Because I live in, technically, I've been told, we are the largest county. And why do I say that? Because
hold on one second. Madam Chair, hold on. There's someone doing a report echoing. We cannot have that. Henry, do you have a question?
Or you want to tell me something?
Henry?
Do you want to tell me something, Henry?
Henry, because your mic was on. That's why it's throwing me off here. I can't tell.
Actually, I can't.
Henry, your Wi-Fi is very poor. I cannot hear you. Henry,
all right.
Henry, I'm just going to remind you, your Wi-Fi is interfering. You might be at the developmental center. As usual, there's always a signal problem there. You may need to link your Wi-Fi to your cell phone.
Okay, can I go on?
Here we go. Hold on one second. Let me just check.
Okay.
Henry, now it goes on, it goes off. It just came on and then it works. Okay. There we go. Henry, unmute for a second so I can then continue.
He put in the chat he's having connection.
Yeah, he's at the developmental center. As usual, they always have a Wi-Fi problem. That's why I use my cell phone Wi-Fi instead, because their Wi-Fi is so poorly right now.
Yes, we've had issues before on the joint council.
Yeah. Let's
I know you're there, Henry.
I know you're there back and forth, Henry. I'm going to send you something on the chat. Just keep your system on. Continue, Madam Chair.
Okay. So, as I was saying, the role of the statewide advisory council, yes, we do meet with the commissioner. And the reason why I say Brooklyn is considered the largest, I'm talking about getting of all the counties that are most populous, is because one of the roles of the advisory councils before COVID, we used to do visits with a person from our local Brook Developmental Center, BDRO, and we would do site visits to certain family support programs. We also used to do an RFP process, and what we would do is sit there and decide which of the agencies would be getting the family support contracts. But one thing is that you see upstate, because, and I'm talking about outside of New York City, they don't have the same amount of
Chris, I'm sorry, Debbie. Chris, I think you need to mute yourself while Debbie is speaking. Thank you.
It's that someone else is interrupting.
Okay, I'll go on. Thank you, Rose. So we would have to see outside New York City. This was brought up. Question is, why doesn't Brooklyn, Manhattan, and New York City sit and do all those reviews? Because as they told us that my council, which happens to be we have a lot of contracts, family support contract. They said that I would never be able to leave the office. I'd be there Monday through Friday from 9 to 5 with them, going over every contract. Because there was one time for 1 year when we had to do we were doing reviews, and this is before COVID. As chair, I made sure to read every contract that went, any RFP that went before, because just in case there was a problem that the parent member of the advisory council was sick and could not, I could help take over with their notes to make sure there was parent representation. When Margaret told them all, they said, because they were giving me the most hardest time, and she turned and said, Deborah, why don't you tell them that you got over 200 RFPs to read? And they went, what? You see, that's why, as I say, we're similar and we're different. We have so many people in Brooklyn as well. I'm only going to go by Brooklyn, that there's certain roles of the advisory council we can't completely do. But yes, we do help families understand what the family support services are. We also help the families, because one of the main goals why family support services was started, thank God, is so we could keep our child home as long as possible, and that when eventually we get them ready to be eventually in what's the appropriate residential placement. It doesn't mean I'm not telling the family. I don't tell the families how or where. We explain to them what happens and how to get your child prepared to do residential. We also help them understand that your child has graduated from the New York City Department of Ed at age 21. We also help them understand, well, there's SEMP programs, there's the employment training program, there's also day habs, different with walls or without. And we try to let them know what services there are out there so that they can figure out what's appropriate for their child. And that's one of the roles of the advisory council, because you see a lot of families think, oh boy, I'm the only one who has a child with a developmental disability. Oh, nobody else understands what I'm going through. And we do understand, because we know what it's like to have a child who may not act the same way as the children in their age group, and it's not easy. And we want to make sure that you understand that we're there. We have your back. I'm not going to access or get you services. I'll be there to support you. I will guide you to help you learn the right way to look through on the computers. If there's a problem, we will help you write a letter of complaint. I'm not going to do it for you, but we'll help you.
It's like a mess.
Yes, who's talking besides me?
No, I caught some. This is Chris. I just caught the hacker that was trying to interrupt. I just stopped him.
Thank you very much. Rose and Janet or him, do you have, you want to add anything to what I said?
Janet, you're muted. Can you please unmute? Or Rose?
No.
So what I'm saying about the advisory councils, which used to be known as consumer council.
Sorry to interrupt you, but the person that's not responding, that is interrupting.
Hi, good morning. This is Angela Blades. I just joined your meeting.
Okay, because I need to know who's please identify. Thank you. Duty noted.
Thank you, Angela.
Please continue.
Okay, so I'm saying the importance of the councils is because we're letting the commissioner wants to know what's working, what's not. And also, what's very important, we're letting our local, like I'm just going to say Brooklyn again. Am I saying, did you hear? Wait, Jan, what you saying? I can't hear.
Getting some feedback from you, Deb. Like you
Okay.
echoing. All right.
I got it. I got it.
What I'm saying is that the council's role is to inform the local developmental disability region office, since we're in New York City, the New York City office, as well as the state, the Albany, the main central, what's working or not working. We go, of course, through a chain of, we work together. The statewide advisory council, which has 19 parent members, we inform them what's working or not, or how we can improve it. So our role is far more important than a lot of people and a lot of agencies and people may think. No, we're not taking over, but we want everybody to know, like, example, does this reimbursement, is it working? Is it helping? When we had the before COVID, of course, we had a lot of after school or weekend programs. Are they working? Right now, I'm not sure if they're coming back slowly because it's COVID. Because of COVID. But what I'm saying is our role was to inform, like if a parent calls me and complains, I listen, I try to help them to the best of my ability, and then I try to find out who should we forward the complaint to. If I'm not sure, of course, I'll send it to my coordinator. And also, if I can't get through to my coordinator because they may be out, I send it to the supervisor. But I try to let them know, this is an issue. I'm not sure how to deal with this. I'm letting you know. Please help. That's one of the roles of the advisory councils. So what I'd appreciate a lot of agency people to please, when the families don't understand, bring them to the first thing is family support services. Because the front door explains how you come into the system, and then to let them know why there are family support service councils. The importance, because yes, we oversee the different services that help you keep your child at home. Also, if you're not sure if your child was diagnosed correctly, we have the agencies like NICE said, a few others who have what we used to know as non-Medicaid service where they would help you come into OPWDD to get the help and services. So this is some part of helping the families understand, like you see where it says providers, explains what service providers are, what a crisis management under the OPWDD umbrella, not OMH, which stands for Office of Mental Health. It's very important. Also, incident management trainings, choices. What happens if if you also know somebody who wants to work for OPWDD? They give you that also. There's different ways, but if you can help the families, go on to the websites and explain to them where to look. and go slow and easy. It took me a while because some of the booklets when I first started looked like a technical manual, and I'm like, I can't break this down. I actually said something. I got yelled at, and then I said, but you know what? You tell me I'm not a professional. I know I'm a parent in this field, but I don't understand what you wrote for me. Can this book be broken down? And finally, they listened, and then we got the tri-folded, what's like a basic of what's family support services. And I used to come back with the pamphlets from the statewide, or when we were lucky enough to do conferences upstate every 2 years. This is the updated information, and I would share it with everybody. Now, because we were allowed to do, which is and I thank God we have our website for the Brooklyn Family Support Service Advisory Council, where we link you to OPWDD. So we let the families know, well, this is what family support services are. This is what the councils do. This is also if your child, when they leave, say, Department of Ed, we show different services, but you see, not every family understands. And then also we get families asking about self-direction. Yes, there's information on that, but try to get the families to not be too overwhelmed, which is not going to be easy anyway, because honestly, even after you get it and you know what you have to do, it still can be overwhelming, because to get the right services for your child is not easy. It's also because we do have a shortage of workers. Our state workers, that's from OPWD, work very hard to try to make sure stuff is processed correctly, and they do a great job on that. But as I said before, we have to make sure communication is a two-way street. You have the right to make complaints. If you don't understand something, that's okay. Because honestly, OPWDD has evolved so much over the years. Remember, family support was started as a pilot project that ended up being so well received that it became now it is a very important service. We also remember OPWDD started as Office OMRDD, and we now have evolved to OPWDD. We have evolved on how we now have a START program, which helps families whose children have severe challenging behaviors. And it just doesn't always focus on the child, it also focuses on the families. When I first came into OPWDD, then OMR, it wasn't like this. And we're going to keep evolving more and more, because they're not going to the gigantic state schools like we had with Willowbrook, which wasn't, hear me out before you get anyone else, it wasn't terrible. But it became terrible when the New York State Assembly and Senate cut the budget. That's what made it terrible. Because you can't expect one person to feed 40 people. Or 40, and who know they're people, they were children in a way, because they didn't develop. And also, what was horrible was that either your child had to be 18 to get services, unless you were super poor and were on public assistance. And that doesn't just include for New York City, of course, New York State, where you could get Medicaid to pay for some of the services. So family support services was started so families didn't have to pay for their services. So it's very, very important. Rose, please continue.
No, yes, this is great. This is a lot of information, and that, as we said at the beginning of the meeting, that we have a packed agenda. But I think there's so much that we can share and discuss, and I think, like I said earlier, that this is why family also have to rely to get assistance, from the care managers. There's so much information to navigate, right? We're gonna start. It's about 11 20 right now, so we're going to have to go ahead and move towards announcement. But I think we might have to break down again and have another session on self-directions. There's a lot that we can talk about, and maybe we can even break those tabs under OPWDD into a separate, conversation, so we don't throw so much information at you all at once. So this is great. I think this is a great start, and we have a platform to continue to get you acquainted to the OPWDD website and any tabs that family members want to focus on, going forward in our meetings.
Excuse me, Rose. Excuse me, guys. Excuse me, guys. Sorry to interrupt, but there are people who have questions that are on the chat. I do need to give them because they're waiting patiently. They do have some questions. I need to respond on the chat.
Okay, Chris, go ahead with the questions.
This will be quick because then I can get these done. I don't have any hand raised, so that's a good sign. So let me get back to the chat. Okay, here we go. One person said, this is great information. As I did say, they did say they like the way they saw where the information is. And they know they see the contact in front of them right now, so I'm saying that adding. But they're asking, the information is thank you for giving us this briefer of the role of OPW website and getting to know the website. This is very good information and showing us what a council can do. It does help us, and I'm trying to read this the best I can, so please be patient with me, Rose and Debbie. This information is very good to know, and now I will learn to use this website and as well as the other 5 borough councils. This information is wonderful to know, and thank you, Ms. Greif and Rose South, to giving us this great presentation. Do you guys want to respond to that?
No, that's great. You're welcome. That's the goal of the committee, right? This is to educate and train, and for all of us to learn together. And again, don't hesitate if you have more questions to bring them, to this committee, so we can all discuss them together and find the solutions, on how to move forward.
You're welcome, everybody, and I agree with everything. I understand. We will work together. We will also, please let us know what subjects you would like us to touch on when it comes to OPWDD2. So again, thank you, and I understand.
The answer to your question you just mentioned, Rose, they did actually ask this question. They want to know, what is the role, if it's possible, can you bring someone from self-direction? Because we're getting a lot of information that, and Ms. Greif, can you mute, please? Because it's causing an echo. Thank you. I'm trying to read this. There is too much communication with self-direction because they're not, every time we have questions, A, they don't return my call. B, they feel like they're very rude to me on the phone. And C, when we do put these complaints in by email or by phone, we still don't get courtesy or respect or respond back and dealing with this problem. Yes, this is also dealing with an agency as well. The way it's going right now, who can I trust? That is the frustration that I have. But also to say this is, today's meeting does change me a little bit to feel that I know that we have rights as well. Thank you, Ms. Greif. Thank you, Ms. Rose. And thank you, Janet Davis and Henry Najib. It is great to see you all.
All right. You're welcome. I'm sorry that you are having frustration regarding, self-direction, but if it's a particular provider, as you mentioned, maybe emailing that particular provider, trying to find out who's the supervisor, a program director, executive director, however high you can go to get your question answered, you can start from there if it's a provider. We can also always contact the DDRO if you exactly know who your who is that case manager that's you working with, so we can get you some support. And we will have a training on I'm sorry, I just lost.
You mean self-direction, what it is and what it isn't?
Yeah, let me just add one thing. Yeah. Go ahead, Rose.
Yeah. Can you guys hear me?
I can hear you, Rose.
Hello? Yeah.
Rose, I can hear you.
Okay, I'm sorry. On my end, it looks like my mic just went off.
No,
Yeah, so in terms of, we could get someone to come in and definitely talk about, self-direction to give family, some more support, and maybe who to contact when they do have issues regarding self-direction, or maybe the local DDRO might be able to assist you. So there is support. So don't just stay and not say anything, and stay quietly and not seek guidance if you are frustrated and if you have any questions. We are all here to support you.
Rose, just to answer your question, they don't want to say the name of that person, but they still want to say thank you to that person. I do attend a certain training, so and I promise not to say the person's name, but I do want to thank that parent advocate. Plus, also, Rose, just to let you know, I have now transferred from another CCO, and I do need to remind them, don't have to say the name of the CCO, so I'm making that clear. The last question is actually from a CCO. It is from Ms. Sanchez from Care Design. This one's for Deborah only. Deborah, that really is important that families are understanding they do not have to navigate the system on their own. Because they do not have the CM, which really, guys, I wish you put the whole word in, please, guys, because sometimes people need to understand.
I think she
Yes.
meant care managers.
Okay, but we like to keep the whole words because some people do. I need to make sure I understand care management because this one is not on the private piece. This one is actually on the with everyone. So this one is just for you, Ms. Gripe, and that was the last and final question.
Thank you.
Actually, and now I'm lying because now another one just popped in.
Oh, boy.
Well, no, because this is a group that just, and now we'll make this clear for that group. This will be the last one because we, as Rose agreed with me, we want to make sure we get the announcements out on this.
Go ahead.
Rose Sal, and Deborah Greif, I do want to thank this opportunity, what you did. I am emotional right now because you guys, your teamwork here, and I want to thank the two DDRO staff who was here today. When I see their names, I am very happy. Forgive me, I am emotional. I have to say this. I am. P.S. They're also saying thank you to me. You're welcome, and they want to say thank you to the other fourth party, which I don't know if she's here, but yeah, she's here, and I'm not going to say her name because unless I have permission. She told me I had to try to attend this meeting, so she is saying thank you very much.
I'm going to say you're welcome very much, right? Rose and I are saying the same
Yes.
thing.
Yes, we're saying you're welcome.
You're welcome. And we also thank Janet, Henry, and yes, thank you too, Angela, but that you were on, that you came on. It's very important. Well, and you see, Rose and I believe in teamwork, and that's why we've agreed to do this together. And I thank you, Rose, because it's fun being a team member. So, but I'm going to let you handle the announcements, okay?
All right. No, thanks everyone.
1 second. Rose, do you have your report you want to do?
So I have a brief report, and I think I've kind of mentioned it a little bit earlier in terms of our next meeting. We are working on a speaker for our next meeting on March 9 to provide us with some guidance on ABA therapy. And then April 13th, we want to do another session on guardianship. So those April 13th is already confirmed, but March 9th, I'm still working on a speaker for us.
Yes, Rose, there it is. Oh, sorry. Rose, there is a question on their chat regarding when you're mentioning you mentioned, can you repeat the first two? What's your March 9th and April?
March 9th, we're trying to get a speaker to talk about ABA therapy. I think it was brought up to my attention that a lot of family members are asking for this type of therapy, and we want to have someone to come in and talk about, who's eligible, what it is exactly, and how family member can apply for it. And the next one is going to be about guardianship.
Oh, Rose, I'm going to spell it out. What ABA is stands for Applied Behavior Analysis.
Great,
So
thank you.
You're welcome. No, I'm not explaining what it is. I just gave out the full name because we have to sometimes stop using acronyms.
Yes.
Until we know our families and even some of our professionals understand what we're saying. So that's all I'm saying. All right.
The parent group is saying thank you, Rose and Deborah, because we're getting sick and tired using that acronym word. We like to know what the whole word means. Thank you on the bottom of our soul. And just to let everyone know, in case someone wants to know, their chat is listed as private.
That's fine.
So yeah, I'm sorry, Rose.
No, that's it for me. I was going to ask Deb if you want to go to your announcements or your chair reports.
I kind of did my chair report in the first part of the meeting.
Okay.
I just want everyone to know that we do have the joint meeting next week, and I'm going to do another quick explanation why we did it. Because with COVID, I didn't want to subject everybody to have to go to 2 or 3 separate meetings. And that's why I spoke with the chair of the DD Council, Developmental Disability Council for Brooklyn, which is Joyce Levin. And we agreed that we should do it as a joint meeting because of all the extra meetings that a lot of our providers, including Ms. Levin, had to do because of COVID-19. And we were able to increase our audience of parents with professionals, individuals, and other partners who work with us. And that's why we did it. The Advisory Council will still continue to work as partners with their Brooklyn DD Council. And we're very happy to assist them so they can use our Brooklyn Family Support Service Advisory Council's website. That is the only announcement I'm making. And now we know we have others who are making announcements, so please.
I will be doing my update for the Joyce Levin's DD Council. So let me add, since you added that, thank you, Deborah. Just to remind everyone also that is on February 16th. But now I do need to remind people that Joyce did ask me to announce this, which is important, that our 5-borough legislative, please state the date for March 4th. This information is available on our website, Facebook page, and it was emailed out. So please make sure that you try to attend. There will be more information coming soon. And remind everyone that we have, there will be more detailed information in the next week's meeting that Joyce will be bringing up. So please save the day for March 4th from 10 a.m. to 12 p.m. It will be hosted on Zoom. So be ready for that. Also, save the date for March of 2022 of the Advisory Council Outreach Update. We will have a very, very special speaker coming. That I am not telling because it might be true. It might be false. Some of you are asking me, is it Joe Biden? I'm going to say no. Some of you ask me if it's Andy Byford. No. Well, it could be, but I'm going to say no still. That you're going to have to find out. And just note, due to the legislative is next door, we're not meeting on the first Wednesday. I will let you guys know. It is not going to interfere with Rose's meeting or the joint meeting, but it will be announced. So stay tuned. And this will be reminded at next week's meeting. And one thing I'm going to get this everyone off my sugar not mind. Mass Force, it is February 23rd. We are looking for volunteers. Let me make this clear. Volunteers can help and give out masks. And it doesn't matter where. They are located in all 5 boroughs. Yes, you see a picture of me because I am now a team leader for Mass Force as I fought for an additional one in Brooklyn. It is not fair that Atlantic Avenue has to go all the way out to the other ends of the earth. We had to split it up. So, anyone who's interested, please make sure you register. It's very easy to do it. Go onto your Google page or just go on with all your Apple and type in Mass MTA Mass Force. February 23rd, it will be, the times are morning rush hour or evening rush hour. That can be 7 a.m. to 9 a.m. and 9 a.m. to 11 and 4 to 6. Coney Island would be the only one will have 2 to 4 and 4 to 6. As you're aware that parts of Brooklyn, we do cover not just one terminal. We do go up to a zone, which is a train lines. So please make it clear. And also remind you, masks are still must be worn indoor stations. So if you're entering Atlantic Avenue, which you see that picture, you better be wearing a mask because the MTA police will fine you $50. And once you're at an outside station, you do not have to put the mask on until the train arrives in, and you must put it on. And very important also, as we're still in the winter seasons, do not run, do not jump, because we're seeing too many running and slip and sliding. Please take your time. If you miss the train, well, that's why there is another train that comes not far behind. Please be safe and please be careful on that. That is something that MTA President Craig and the chair and CEO, and forgive me, it's hard for me to say names, they are asking to please be safe. And that's what putting on the buses as well. And let me just move on to the next. And a reminder, everyone, our website is still have the information on the OPWDD information. As Deborah mentioned earlier when we did the presentation, our information has been updated with new additional information. And I have seen a lot of people on, so I do thank those people who have been on. Especially I'd like to thank all the CCOs who are getting on as well. But also remind you, make sure you go to the Family Support Guidebook. Now, I'm going to remind everyone, they're located in 2 locations. They're located at the OPWDD/BDRO or the service openings page, where your agencies that you guys make an announcement, please make sure you email that. And I remind you again and again, please make sure that you not just visit the website, but if you have service openings, trainings, events, or you really want to make sure your service openings are in there, please email us as soon as possible, like today, so I can add it in. So you guys have things ready for them. We have been getting a lot of new trainings coming in. I do want to thank that it's going in. Please make sure you pass that along as well. So please, everyone, any questions on that? Okay. Since no one has a question and nothing on the chat, just give us 5 seconds. As I get ready, folks, if you have an announcement, please raise your hands. And please do not be hiding. Thank you. Thank you. Okay. It's time for announcements. My favorite moment today. Starting first, I think we have a young lady named Sandy Naper. You're on. As Sandy comes on, we'll give her a second. Do we need to start singing Sandy, Sandy, Sandy? And I don't hear her because she's muted. Sandy Neighbor, you can unmute.
Hi, everybody. You hear me now?
Yes.
Okay, that's great. I'm Sandy Naper with Adapt Community Network, and we are very happy to offer a free webinar this coming Wednesday, February 16th, from 10 a.m. to 11 a.m. It's called Speech and Language Development What is a speech and language delay? And our speaker is going to be Ms. Harla Rudolph. She is a pediatric speech and language pathologist. She's got 25 years of experience, and she's going to be discussing what parents should look for that may indicate that their child may have a speech or language delay or disorder. And she'll also provide recommendations for what to do next if your child has a speech or language delay. A Spanish interpretation will be offered, and to register to receive the Zoom link, please email familyconnect@adaptcommunitynetwork.org or call 718-436-7979, extension 704. And I will put that on the chat. And I thank you very much.
Sandy, just stay where you are for a second because just want to use you as an example. Sandy Naper had sent me this even before the meeting. So I want to remind everyone, it is important. If you have service openings, please email me. And that's double for all CCOs as well. So please, Sandy's agency, and I will remind not just Sandy, but 3 of her staff sends me enough stuff that I can tell you that no wonder why the website's so flooded, but not just her, but everyone. Please make sure. Sandy, we also have a question for you.
Yes?
First of all, the question is, you do have other trainings that you do at at ADAPT. Do you have any other trainings that are coming up?
I don't know of anything right now, but as soon as I do, I will let you know, and I'm going to email it to you so you can put it on the website.
Okay. Second question for you is, I speak Spanish. Do you have translation?
Yes, there is going to be Spanish interpretation at all the Family Connect at all the Family Connect trainings. We do have Spanish interpretation. So
Thank
that is
you.
all.
Sandy, they're saying thank you so much. They just wanted this is a new parent in the group.
Oh yes. Oh, I hope she comes to this one. But yes,
Well,
we do have.
They needed. This is what they're saying to me in the private chat. They're saying they needed to hear from you because one of the parents did not believe it. So thank you for that. Duty noted. Duty noted.
Absolutely.
Thank you, Sandy.
You're very welcome.
Let me just double check. Since everyone is hiding from me, Rose South, do you have a regular agency announcement? I always love your announcements. And she's going to ding to me.
No, I have my usual announcement with programs opening. I'll put it in the chat in a few minutes. Our Day Hub has opening. We have opening in our community hub. We have opening in our community pre-voke. As you guys also know, I've made that announcement before. BCS was awarded some grants in partnership with OMH, and we have CVIS, housing opportunity for individuals who are dual diagnosis and also have a history of homelessness. And I think I have them in the chat. Those are only my announcement for program openings.
Rose, can you make sure you email that to me, please, so I can add it to the website?
Okay, sure. I will do that.
Thank you. There's no questions for you, Rose, but thank you.
You're welcome.
Let me see. Care Design, the famous Maria Sanchez, Miss Sanchez. I'd like to hear from you. How are you, Miss Famous?
Hi, how are you guys? As far as announcements, like always, we don't have closing and enrollment, so anyone is more than welcome. We are enrolling just Brooklyn region. For the Brooklyn region alone, on a monthly basis, it's about 20 individuals. So that is still happening. But one announcement, maybe, I don't know if GHO is here, we do need care managers that are fluent in Mandarin and Cantonese. That is something that we are in need right now.
I have not, just letting you know, Pat, look, because it's Chinese New Year, But I would suggest if you get a chance, contact her or email her, and we can, we'll make sure. But I do appreciate what you're saying. Thank you. Oh, we do have a question for you, Ms.
Sure.
Sanchez.
Yes, sure.
Make that 2, which I don't know why someone. Oh, never mind. My fan club.
Messages received from Rodney Hagan.
Sorry. The question is they want to say thank you. It seems we're getting a lot of thank yous and compliments. I'll just go this quickly. They're saying thank you very much, but can you please put your care design information? They're asking.
Sure. Like my email and telephone number.
Whatever you want to get, what information you want to put in.
We'll do. No problem.
Whatever information you want to put in. It's just that they're just saying, can you just please put that information in, whatever number. But they're asking for Espanol.
Yes, I do speak Spanish. That's no problem.
We definitely, I definitely know, and I'm gonna just giggle on that one. But thank you, Dolores Khan. Her hand is up, and thank God. I almost got worried. Don't give me a heart failure.
Hi everyone. My name is Doris Khan, and I'm the outreach coordinator for New York State Institute on Disability. We're a family support service agency, and we have openings for evaluations for individuals without Medicaid for the purpose of obtaining eligibility. We also have openings in our crisis management services, and we have funds for reimbursement, which is for camp goods and some services. We also provide free transportation for medical appointments and recreation activities. And we also are offering families tickets for venues around the city for the individual and their families to attend. For contact information and phone numbers, I put that in the chat, Chris, who to contact and what phone number to call if anybody's interested in any one of these opportunities. Thank you.
Dolores, do not move from that. Do not touch that mute button. And forgive me a noise, but you know how cars don't understand the muffle it. A question that came in. You guys do Sachalatical, correct?
We guys do what? I didn't hear you.
You see, that's what happened with the car noise. What happened? The question is you did mention that you guys do Sachalatical.
Yes, psychological and psychosocial evals for the purpose of obtaining OPWD eligibility for families that do not have Medicaid. Not have Medicaid. And that would be Liz Sunshine is the person to call if you're interested in having an evaluation.
Because the question is there are 4, and I'm just going to say 4. They are definitely going to contact. Can you please put Elizabeth Sunshine's information on the chat?
I did already.
Can you redo it again?
But her number is 917-699-0578. That's the number to call for Liz.
Repeat that one more time, but slow.
917-699-0578. I also put that number and her email address in the chat.
They're saying thank you so much. They're also saying that they did, one of their parents in there, which I can say parent, did get the testing for her or he, I'm going to say individual, that did get the help, and they said they were very professional. So they do want to thank you, and they do want to make sure that OPWD hears that. As well as Miss Greif and Rose Sal. So Lady Rose and Debbie, have you heard that? Thank you.
Yes, Chris.
Well, I want to make sure, because I'm making sure they're just asking me.
Thank you.
Okay. Thank you, Doris. Okay. Razia, who's a parent advocate, do you have any questions or anything you want to say hello to? Razia? I guess not. Okay. Rose and Debbie, do you have anything else you want to add before I depart? Before we end? Which we're actually on schedule. We're fine. We're like.
No, I really don't. Just thank everyone who participated today. I appreciate everybody. And also I thank every agency that with all your announcements. It's very helpful. And thank you, Rose.
No questions. Thanks everyone for being on. Expected to see you again next month.
Mm-hmm. And remind everyone, next Wednesday is the meeting. Please,
Today.
guys.
Not next month, next Wednesday.
I said next week. Somebody
No,
interrupt.
but Rose said next
No, Chris
month.
said next month.
She's saying next month for.
Oh, for the provider meeting. Okay.
For the provider meeting is next month.
Information. See what happens when you interrupt?
No, it's okay.
You're not gonna pick on her. You're not gonna pick on. See, you gotta have a sense of humor. But let me just remind everyone: next Wednesday is the meeting. I am remind everyone we like to start at 9:55, like I did last month. We started on time. I like to end on time. Please try to get on. So therefore, you can check A, your microphones, B, your Wi-Fi, and C, make sure you have your paper and pen and a cup of coffee with it. Okay. And adding the last person who had announcement, she's saying, "Thank you, everyone. This was great information. You're welcome."
Either have a cup of coffee or have a cup of tea or a bottle of water.
Now, as Rose mentioned again earlier, the next family and provider information. So let's make this clear. It's for families, provider information committee is March 9th. Is that clear?
Yes.
Rose, is that clear?
Loud and clear.
That's the second
Yes.
one. So,
all right.
Ladies and gentlemen, as I will say, I love doing this part. Happy Valentine's Day to all the young ladies and all the mothers, grandmothers, aunts, cousins, whatever you what. And please, to all the men who are still here, please make sure you get something for your ladies, mothers, fathers, and make sure you wish them happy Valentine's Day.
Yes, especially do something special for your mother. You walked right into that.
And also, happy Chinese New Year. God hey, fa choi. And for Rose and Angela and everyone who I did not see, can I tell, happy Black History Month.
Thank
and
you.
I finally said
Thanks,
it right.
everyone.
Yes. Thank you, everyone. Have a great day. Enjoy the weather. Get some fresh air. Bye, everyone.
Bye.
Thank you.
Bye.
Thank you.
Thank you.